exercising with clients with high blood pressure. High blood pressure is a chronic condition of elevated blood pressure of over 140 over 90. The contributing factors to high blood pressure are hereditary factors, inactivity, high salt intake, diet, heavy drinking, obesity. And high blood pressure can be dangerous because it can contribute to heart attack, heart failure, kidney disease or stroke. It is advised to seek medical clearance and guidance when we train with people, with clients with high blood pressure. Exercise is beneficial for these clients. However, there are some exercises that are contraindicated, such as Valsalva maneuvers, isometric prolonged holds, heavy loaded weights, and especially them being pushed up overhead, exercising to the point of exertion, and any upside down positions. When we exercise with these clients, we want to choose about 8 exercises per session for muscles of all major muscle groups, and we want to perform one set of about 8 to 12 exercises, making sure that the client takes adequate rest of 60 to 90 seconds between the sets, and then they breathe out on the effort part of the exercise. And so if we want to substitute the exercises that we should not be doing with these clients, such as overhead presses, we would choose forward pushes or pull exercises, and never hold the exercise, the isometric hold, for a long period of time, and always breathe out on the effort part of the exercise. Lower back pain is a common condition amongst adults. It can be caused by prolonged sitting or inactivity, improper exercise techniques, and also any specific injuries. It is important to seek medical clearance and guidance for exercising with this type of clients with low back pain. The exercises that we should avoid with them are any heavy loads, and then especially loaded spinal extension, flexion and rotation. So keep the load low and the repetitions higher. Keep the spine in a neutral position initially until the client is ready and doesn't have any lower back pain and has got the strength built up around the spine before progressing to other spinal movements. So for example, instead of a sit-up exercise, we could choose an exercise in supine position with neutral spine with leg floats. Instead of exercise like spinal extensions, we choose exercise that's performed on all fours, hands and knees, and the leg can float up and the arm can float up. Again, for the core control. And instead of doing heavy loaded squats with a lot of weight, we would choose to do just the body weight. And also teach the client how to activate their core properly so that they don't injure themselves further. Keep an eye on their technique as they do their exercises. Knee injuries can happen through overuse, awkward movements, falls, or during sport. It is always good to seek medical clearance and guidance when we exercise with clients with knee pain and knee injuries. The exercises to avoid are any high impact exercises such as skipping or jumping, unstable surfaces, sudden changes of movement, full flexion, as well as any twisting movements. We always want to make sure that we exercise with the client in proper alignment and in a range of motion that's appropriate to them. And the exercises to modify would be, instead of choosing skipping, we can exercise on a cross trainer or a treadmill to keep the exercise low impact. Instead of doing heavy loaded and deep squats, choose the range that's appropriate for the client. And instead of working on unstable surface such as Bosu ball, we can just exercise with the client on a stable surface on the ground before they start getting stronger and can progress.